Um, Hello, everybody. A 1995 graduate of Menlo, Dr. Sanaz, graduated from Harvard and then from Stanford Medical School. Sorry, still admitting people from the waiting room. She did her residency at Harvard in orthopedic surgery and had fellowships at both Harvard for MGH, joint replacement, and then Stanford for sports and arthroscopy. She currently has her own orthopedic practice in the Bay Area. Welcome, Dr. Sanaz.
Okay. Hi. So, um, mostly what I was hoping to do here is to just describe my journey and who I am, and then to field questions because, I came from a family that didn't have any doctors. And so I did it all by feel. And I know that if I was in this situation, I would have had a lot of questions. I would have appreciated a lot of answers. And in fact, actually, I was lucky enough to find mentors along the way who were really helpful. And so, if I'm able to be helpful, it'd definitely be my honor. So, I was born in Tehran, and I came to the United States when I was 2 years old. The revolution had happened when I was two, and I grew up in Menlo Park, and I went to Sacred Heart, and then I went to Menlo for high school. And when I was pretty young, I had access to 49er tickets through a contact of my mother's. And we grew up going to 49er games, and had season tickets and went to some really pivotal games. My first game ever was the Super Bowl with Joe Montana against Dan Marino at Stanford Stadium, which is walking distance from my house. And I was pretty sure that my calling in life was to be a football player. And I trained, and I went out for the Pop Warner team, and shockingly, it didn't work out. I did not make the team. And so, with that dream done at a really young age, I looked for other ways to get involved in football. And one of the things I noticed was that there was somebody who was not a coach, not in uniform on the sideline, and that happened to be the team doctor. So, in my little 8-year-old head, I was like, wow. So, gosh, the team doctor's job is to watch football. And that's like the best job ever. And so I decided, all right, I need to be an orthopedic surgeon. And right away, I just did everything orthopedics. Like even in the eighth grade, my eighth grade thesis was turf injuries versus grass injuries in the NFL. And the team doctor, the Niner, I sought him out. His kids went to my school. They were much younger, but they were there, and I got him as a mentor, and I got to shadow him in high school. And when I got into undergrad, he gave me advice, and he said, "Hey, look, I was a history major. So he had gone to Stanford. This is Michael Dillingham, and he was a history major. And he turned around and says, I think you should be a history major because it'll make you a more well-rounded person and a better doctor because you'll be able to communicate better with patients." And so, yeah, that one comment, I was a history major at Harvard. So my education, I went to Harvard for undergrad, Stanford for medical school. And then I went back to Harvard for 5 years for my orthopedic residency. I stayed there for a knee replacement fellowship, and then I went back to Stanford for a sports fellowship. And I would say that I worked really, really hard at every stage. I cannot imagine anybody working harder. They might have worked as hard, but really to the detriment of everything. I really just didn't do much socially other than extracurricular. So there's extracurriculars that I was really passionate about. So ballet, childhood education. So I worked at Head Start programs, things like that. But in terms of sort of social and vacations and, when we would have a break, for example, in med school, we had a break between quarters, and it was a 1 week. And I literally just went to the library and read all the textbooks for the next quarter. And in fact, I'd read different textbooks, not the ones that we were going to do, just so that I wouldn't get bored when I read the textbook the second time, and this is kind of interesting because sometimes we take exams and I'd get answers right that the teacher hadn't taught. It wasn't in our textbook, just to create a curve. And so they're like, where did you learn that from? And I kind of told them my secret, and they're like, you're crazy. You really should not do that. So I was really determined to do this. And In hindsight, did I have to do all the work that I did? Well, I think psychologically I did because I was so determined to become an orthopedic surgeon. I really didn't want to risk something that I could have done on my end not to do it. And the other thing is that just in general, if I'm going to do something, I really want it to be the best possible. And it was really important to me that every step that I did, that there really couldn't, I couldn't have done it any better. And just knowing that. And for my surgeries these days, like I am the same way as a surgeon. Like I don't do surgeries that I can't be really confident that there's nobody in the world who could do it better than I can. Probably they could do it at the same level, but nobody who could do it better. And that gives me a lot of peace of mind. And that's always been my theory for every single step in my education and my training. That comes with great sacrifice. And so I know that that's not a universal. You don't have to make those great sacrifices, but you do have to make quite a few to be a doctor and especially a surgeon, because the amount of time and training is just incredibly hard to imagine if you haven't done it. Like, for example, during residency, we had it during the times when there weren't the work hour restrictions, or they were just coming into play and they really weren't codified very well, or actually implemented very well. And so, yeah, it was minimum 90-hour work weeks, and that's for 5 years. And so one of those things in medicine is that you just have to put your head down and go through, and it behooves you not to question the process, because you'll stop and think, and then you shouldn't be thinking, you should just be doing, because it's just one of those things where, like, it's a road that you just have to keep barreling down. It's the MCAT, then it's the 3 steps of your boards, and then it's other boards once you get into your specialty. But on the other side of it, it's so awesome. It's the best field ever. For women, it's incredibly flexible. If you're thinking about having a family, not my profession, surgery, that's not flexible, but you could be a dermatologist, or other fields, or radiologist, where you can titrate your work better. For anybody, it's just a feeling that you're making a really good living, and you're doing really good work. Like, you're helping people. People are really grateful. Like, for me, I mean, the simplest thing, doing a cortisone injection for a 94-year-old nun who lives in Los Gatos at one of the retirement centers, and she can walk around the garden because of that, and she's super grateful, and she says, "Blessings to you, Dr. Hariri." And I was like, wow, that's really good, and I'm getting paid for that. That's just awesome. So to have that moral feeling that you're doing really good in the world, not on an abstract level, but like right there, one-on-one, and you're making a living, and you could take care of your family, and that you really put in a lot, that something. It's not something nebulous. You actually put in a lot of effort. You learned a lot, and now you know a lot. And so that's kind of where Latin comes in, actually. So I was part of JCL when I was in high school. Actually, I helped my best friend Sarah at the time do she's still my best friend, but yeah, to do the convention way back then. And Davi Vasquez was my teacher as well. And so Latin is really important for medicine, because it's part of medical schools learning a language. And that language is almost all based on Latin and some Greek, right? But if you know Latin, you have a huge advantage, because words, you're not memorizing them. They just make sense. You look at it and you're like, oh yeah, that word makes sense. Of course it describes that, right? So you go from a situation where everyone else is memorizing words to you just like, oh yeah, that makes sense. Okay, that's what it describes, and you don't have to memorize it. Just that's a huge hurdle. So medical school is learning a language, and Latin is that language. And if you already know it, wow, what a huge advantage that was to me. It really helped me significantly. And there's also tests that you're going to have to take along the way that they're just words that you're unfamiliar with, but you can reason through them because of Latin, and that's going to help you tremendously. People who haven't taken their SATs or ACTs, I don't know where that's going these days, but that was tremendously helpful too. So that's my journey. That's where I'm at right now. I live in Menlo Park right now. I've got twin 8-year-old boys. Um, and I'm really happy with my choice of where I went. And I'm also very happy to describe what the difference between being a surgeon and a non surgeon is. So I find that if you get into medical school, it is not like one of those things where, like, okay, you got into a field and now it's narrowed down your choices. All of a sudden, your choices are like even more than you could have imagined, because you will do rotations and you will see that there's so many fields you can go into that have different temperaments, that have different lifestyles, that have different risks and rewards. And so getting into medical school is one of those rare moments where the next step is not narrowing, but actually widening, incredibly widening. And so I think a lot of the advice I'd give to people is that be really honest with yourself about what your temperament is, and what you want out of your life. Like, do you want more flexibility? Do you want more intensity? Um, Surgery is much more intense. There's just incredible risks with it, and they're very personal in terms of the patient, and they're very impactful. This is not like titrating a dose of medication from 25 milligrams to 37.5 and seeing what that happens in 2 months. No, like, your decisions are really impactful. And then there's a lot of another part of it is that you could do everything right and things won't turn out exactly the way you want it, because you're dealing with human beings who may or may not do the rehab that they're supposed to do, or may have really poor nutrition or hygiene. And you got to this point as a surgeon because you've been incredibly diligent in taking care of every single detail, and everything's under your control. You studying is under your control. You doing your research and writing papers, that's under your control. And then all of a sudden you're doing something that is your whole life that isn't fully under your control. It's mainly under your control, but then, there's patient factors that are not. And that was a really hard transition for me. That I couldn't make everything right. It's more complicated than that. And during your whole training, you can make everything right because you can just study harder or read that paper one more time and make it a little bit better. So, anyways, I think those are the key points I wanted to get across. And I'd love to just field questions. And of course, I'm happy to also keep babbling, but yeah, questions would be great. Claire, is that on me or on you? Do you unmute people or do they just talk?
You guys can you can just talk, unmute, you can type questions in the chat, you can raise your hand, however you want to communicate. We'd love to hear some of your thoughts and your questions. We have a question in the chat. How long did you go to school for?
Okay, so that's 4 years of high school, 4 years of undergrad, so there's 8. There is 4 years of medical school, so that's 12. 5 years of residency, so that's 17. 2 years of fellowship. Yeah, that's a lot. And I have to tell you, like, it's each step actually gets harder in medicine, not easier, because SATs, ACTs, that's a breeze compared to the MCAT. And the MCAT is a breeze compared to, the boards. So each step, and one of the reasons why it probably gets harder is because the people who are really good at the step before then do the next step. And those are the people that you're taking the test against and then the next step. So that might be part of it. But the information is just massive too, as you keep going.
Here's another one from the chat. What decisions did you make in high school to prepare yourself to go into the medical field? So something more practical to the space that we are currently in as high school students.
So number one is it's really important for you and for what you apply to demonstrate that you actually know what a doctor is, that what they do, and that you have familiarity. So For example, I worked in the emergency room when I was in high school. And I wasn't just kind of like, I work in a hospital, so I know that there's a lot of volunteers. There are candy stripers and such who are just checking the hours. And they really don't have a relationship with a doctor or some administrator there. They're really just there because they want to put it on their application. But when I was in the ER, like I really just glommed on to a couple of ER docs and would try to be there when they were there and be as super helpful as I can. And they were really helpful in terms of giving me background and also giving me recommendations. And for example, when I was there, I noticed that these little kids come in, they're just terrified, and you're just trying to pacify them, and there's really not much you can do. But it occurred to me, hey, how about if I got a teddy bear, And so I started a program, and it's still at Stanford because I walk through the halls, and every year they have the fundraiser for it. So it's called Cuddly Companions. And so we did a fundraiser to get money for teddy bears. And anytime a kid walked into the ER, they get a teddy bear. And all of a sudden, like, they don't even realize it in the ER. They're just obsessed with the cat teddy bear, like things like that. So whatever you do, make it meaningful. But yeah, one, actually for yourself and for the next stage, show that you know what a doctor actually does. Be in a hospital, shadow a doctor. Like, so I shadowed Dr. Dillingham and Dr. Art Ting. They were really kind to me and let me help them. And all of us have had mentors. So if you reach out to people, they're going to want to be your mentor. I worked in a lab over the summers at Stanford doing research. And of course, I would have wanted it to be orthopedic research, but no, orthopedics wanted me. I was just a high school kid. And it's so crazy because, like, even if you don't even ask for money, they're just overwhelmed with people. And it's actually, like, now me being on the other side of it, most people cause more work than they actually help you to do, in terms of like training them. You don't get as much of it out of it, especially for these like little summer stints. But I got a job at the cancer research, looking and just basically helping clean up the lab and do those experiments that are just completely mindless. So they just needed somebody to pipette, measure, like just things like that. And I was there to do it. But on the other hand, they got to train me. I got to listen in all of the lab meetings and be part of it. And so when I was applying to undergrad and I said I wanted to be a doctor, well, they're like, oh yeah. So she's, seen doctors in the hospital. She's seen doctors in clinic. She's been in research labs. It was credible. And so you want to have credibility in your applications. And you also kind of want to have credibility for yourself because A, it makes you stronger at the next step. You have more of a foundation. And B, how about if you didn't even like it? How about if you're there and you're like, oh yeah, this is not for me. This is a time to find out sooner rather than later. So that would be my advice, is get involved in very concrete ways. One thing that wasn't open to me when I was there at that age was being a scribe. So you can train to be a scribe in an ER and a clinic where basically the doctor is examining the patient and getting a history, and you're the one who writes it down for them so they don't have to be distracted. And I think there's a course for it. And that's a great way to learn medicine, and to be right in the thick of action and to be totally useful to somebody. Like if you trained to be a scribe and then went to a local doctor, I'm like, hey, I'm here for this summer. It's 3 months, free labor. I just want to be in there and be your scribe, and I have my certificate. Wow, a lot of people would probably take you in. So my advice at every single stage would be, in terms of getting these mentorships and getting these experience, is figure out how to be useful. Just look at the person above you and be like, how can I help this person? And if you're useful, then they're going to want you around and you're going to get more opportunities. And you don't even have to mind read. You just ask, how can I be useful? Like, how can I make your life easier? And they might not immediately think of it because probably nobody's asked them that before, but they'll think about it later on, be like, yeah, can you do this? And all of a sudden now you're part of the team.
So I was just wondering, do you think that I know you're talking about how you were a history major for undergrad. Do you think that having a more kind of well-rounded education in multiple fields has made you a better doctor?
Absolutely. Part of medicine, the challenging part is that patients just don't do what you say. There was a study at one point that showed like only 1/3 of prescriptions are actually filled and used. And that's probably like the 1/3 are probably old narcotics, So who knows? But I think a lot of it is, and that was just a joke, but a lot of it is communication to get treatment across, and for people to like you enough to refer their friends to you, and to trust you enough to, like, as a surgeon, to cut you open. So yeah, I definitely think that, so if I had gone down the science track, of just like human bio or something like that, I can tell you that people in the humanities, in terms of majors, are a little more laid back and a little more communicative and a little more social. And if you're in that circle of people, then you develop those skills too, the emotional IQ, and that will absolutely make you a better doctor. There's no way you're getting through med school without knowing all the stuff you need to know, and passing, those exams. So, and having the, well, I guess there's no way that you won't be presented with it. So if you're worried that in college, if you're not a bio major, you're going to be at a disadvantage in med school, no, definitely not. The stuff that they teach you in undergrad is very, very esoteric in terms of the sciences, animal studies, things like that. When you get into medical school, it's completely different. And so you're not behind by being like, okay, I was a history major, right? I probably got, and I'm only telling this because I want to I want to encourage people not to become just science majors if you have a passion for something else. So I got the highest score that I've ever heard of on the boards. In my, I've talked to a bunch of people, and it will come up in conversation, like everybody's shocked. And why? Because I was fine. You have to learn it in med school anyway. So if you are interested in anything else, it makes you a more interesting person, a more interesting candidate, and a better doctor. So yes, go ahead and follow that.
Yeah, go ahead, Jade.
Sorry, what?
So,
Oh.
oh, I think there's
Sorry,
two
we had to
Jays.
say no. Sorry, I thought. Sorry.
In high school, if you like, you said about the NFL game and how you realized you wanted to be a doctor from early on. In high school, are there different courses or extra activities that you can that you think helped your path in being a doctor, or that the future generation could do to help themselves in being doctors?
Yeah. So number one, take the highest level science courses you can in high school. Take AP, whatever science you can, AP physics, AP chemistry, AP bio, because pre-med classes are tough. They're really hard in college, because a lot of it, they're weeders too, meaning that there's a lot of people who go in, who want to be doctors going into college. And a lot of people will go to these classes and be like, oh my God, this is way too hard. I'm not going to do it. So if you've seen the material before, even though it's not at that level, so like clearly my, AP class in high school was not Harvard chemistry, right? But man, I knew a little bit going in, had a foundation, right? And if those are available to you, it will help you. So take every AP science course you can take. And if you feel like, oh, but I need to take the honors one before, whatever, just study it over the summer, and then you'll be fine going in. It's not that hard at a high school level. I did that, I would study stuff over the summer. Like I'd actually study the AP, review book the summer before I took the AP class. And it wasn't that hard then, because it's not like they're asking you to like come up with theories on your own. They're just asking you to memorize basic foundational things, and you can totally do that. One of my favorite things to say is like, life is volitional. It's how much you put into it. And so, yeah, so number one, take every AP class you can. Try to take BC Calc, so that you don't have to flounder in calculus when you get to undergrad, because your GPA really matters in undergrad to get into medical school. Med schools are very number oriented. So do that. And then on the extracurricular level, try to get into a hospital, try to get into a doctor's office, try to do some science research. Those will all be very helpful to you. And
Quickly adding on.
Sure.
You
One more
think
thing,
there's
community service. Do community service, because being a doctor is community service. You're helping people, and they want to know that you're getting into it for the right reasons, not to join a country club and golf and stuff like that. You're doing it because you want to be a good human being and help people. So demonstrate that. And even like less cynically, you're not just demonstrating it. It's going to make you actually a happier person the more community service you do. And that's at every stage in your life.
So do you think, you know how you mentioned like all the emergency room volunteering with scribes and everything? Do you think it'd be possible to do it within the high school stage or not?
Absolutely. Yes, I've had summer interns that are high school students. But here's the thing: don't go in saying, "Oh, I'm just going to do this for a couple of weeks." You're going to be more trouble to the doctor than you're worth, right? Because training you is painful. You know, and if for the doctor, that just takes time, right? And it's time that they have to take away from their patients and family. So if you're going to go to doctor, here's my advice to you: commit to many months, 2-3 months, you know, like the whole time. And of course, you're going to take vacations here and there, but commit to a chunk of time so that their training actually means something, and help make their life easier. So again, scribing, or, you know, inputting demographics or medical history or anything you can, just try to be helpful. You can do it. You can be helpful as a high school student, but you just have to go into it not being like, oh, I really want this experience, but more like, I want this experience and I want to be helpful to you. Okay.
Again, if anyone has any questions, if you can put them in the chat or ask directly.
I'm just kind of curious, anybody here like 100% knows that they want to be a doctor? Like this is what their dream is? I mean, it is kind of, you know, even if it's not to be a doctor, like it is kind of nice to have some sort of vision of what you want to do early on, because you can kind of try it on like a piece of clothing and see if it fits you. And also it gives you direction, right? So you're not just so scattered in your approach to life. You're not going to be any good at anything if you're just not directed, right? But if you have direction, then you can actually get depth. And so I encourage you, whatever you decide you want to pursue, it doesn't have to be forever. You could be changing it later on, but choose something and become really good at it. Get yourself some depth. And then again, if it's not what you want to do in the end, fine. But you learned a lot, and you ruled out something in a really thoughtful way.
Okay. If there's no more questions, I think that that's a very, very nice note to end it on. So thank you so much for coming to speak at our convention. We really appreciate it.
Great, Claire. Great to meet you guys. Good luck.